Well, for more, let's bring in Dr. Anne Remoyen. She's a professor of epidemiology at the UCLA School of Public Health and the director of the Center for Global Health Security. Doctor, good to see you. The World Health Organization, as you know, just announced that it's going to coordinate the screening process now for passengers and crew on the ship. Can you tell us what that's going to entail?
Sure. Well, what they're going to do is they're going to really assess the risk and the exposures that these people have had. They're going to check people for symptoms. There's probably going to be some testing to see if anybody has had any evidence of being infected at that point. And then they will figure out exactly the right steps based on protocols where these people should be. People that need medical care will be triaged to medical care. And that, which doesn't seem like anybody left on that boat actually needs, to be clear. And then they will take those people from Spain, put them into quarantine there, and organize, just like they're supposed to do, controlled movement of people back to their home countries.
Got it. All right. So we also just learned that the CDC is sending a team to the Canary Islands as well to bring those Americans back to the national quarantine unit in Nebraska. What exactly will happen there?
So what's going to happen is that this CDC team is going to come. They're going to triage everybody. They're going to get them on a plane that's meant for biocontainment, most likely. But again, because we don't have sick Americans on that plane at this point, that, you know, the conditions of the plane will be appropriate to where people are, then people will go to this center in Nebraska. They'll be monitored for symptoms. They're going to be in quarantine during this time. And then if somebody gets sick, the good news is this center has all of the facilities, the biocontainment, ECMO, all of the things that could be potentially needed should somebody actually fall ill.
Well, you say this isn't currently behaving like a pandemic scenario. Explain why not, and then what makes this, you know, different from the start of COVID-19.
Well, you know, a disease can be serious. An infectious disease can be serious, in particular for the people who were exposed, and not necessarily be a pandemic threat. And that's really important here. I mean, when we think about a pandemic threat, it means this has to be something that's going to be spreading between people very easily and have continued chains of transmission. You know, why is this different from what we saw with COVID? Well, COVID was a completely new pathogen. We didn't know anything about that pathogen. We didn't have diagnostics. We didn't know anything about the symptoms. We didn't know anything about how it spread. This is a rare disease, but not so rare that we don't have data on it. And the data that we have, there have been recently sequencing data that suggests that it came from a rodent species, that the virus has not mutated in any significant way. And so what we're seeing is a virus that is very serious, infected somebody, it got into a boat, into a cruise ship. Cruise ships are, you know, people are in close proximity to each other. This kind of cruise is where it's cold outside, people are inside, they're eating together, they're in close quarters, they're sharing a lot of spaces. So serious for the people there, low risk for the general public.
Dr. Anne Remoyen, thank you so much.